So on that score, it is my absolute pleasure to introduce both a gentleman and an outstanding researcher, and I think we can safely say a researcher whose work has an influence on the way we all go about the things that we do, generally on a day-to-day basis. So for this first plenary, I'm pleased to welcome Professor David Moher for his presentation about what are reporting guidelines for health research and do they work. Professor David Moher is a senior scientist in the Clinical Epidemiology Program at Ottawa Hospital Research Institute, where he directs the Centre for Journalology. David has been involved in developing the science of how to optimally conduct and report systematic reviews for most of his professional career. And another part of his research has focused on how best to develop reporting guidelines, which we'll be hearing about today. He spearheaded the development of these statements that we're very familiar with, the CONSORT statement and indeed also the PRISMA statement. So please join me in welcoming Professor David Moher. David, please.
Okay, thank you. I hope you noticed that I'm wearing the same jacket and the same shirt as in the picture, and I haven't changed that in several years. Okay, but I smell okay. I smell okay, don't worry. So first of all, I want to thank Bianca, Ed, and the rest of the team for inviting me here. As a 12-year-old boy who grew up in Ireland and spent most of his youth in the dunce's corner because I was not able to read, it amazes me to this day that anybody would want to invite me anywhere to listen to what I had to say. So thank you for the invitation. I think I just want to indicate that I have some disclosures of interest that you should know about. And why am I interested in reporting guidelines? Don't I have anything better to do? And it probably reflects something about being dyslexic. So here's a first slide from 2010, a group of authors from Princess Margaret's Hospital in Toronto, which is quite a famous cancer hospital. And these authors looked at slightly more than 250 reports of randomized trials in oncology journals, and they were looking to see whether they reported what I think all of us would agree on are sort of essential items. What's the name of the drug? Does it matter if the drug is effective if you don't give the name of it? What's the route of administration, etc., etc.? And lo and behold, what they found is that a very small number of reports of these randomized trials gave that information. And this sort of reflects, I think, what was being said yesterday, that if you can't report it well, how are we going to implement it into practice for patient care? So I think that's been a good theme of yesterday, and I just think it sort of resonates, and I hope some of you are thinking, well, David, that's 2010. It's 2023, and obviously things are way better. And so what I wanted to share with you is, this is from 2014, the Lancet series, colloquialism known as waste in research. And this is a series of 5 papers in the Lancet in 2014 looking at, are we asking the right question all the way through to how are we reporting the literature. And this is a paper that a great Australian, Paul Glasio, led, and looking to see how were things reported in abstracts, in method sections, results, discussions, and all over the place. I've obviously hit something, but who knows what that red thing is. Anyway, I think if you look at this slide, you'll see in 2014 that the quality of reporting, at least of randomized trials, was not particularly good. So if we move along here to something that wasn't mentioned yesterday, and I think probably we need to think about is issues of reproducibility. So here's a group of scientists, and they looked at 100 of the most influential studies in psychology. And what they tried to do is they tried to see if they could reproduce the results. And what you see here is that on the original studies, the results had a certain effect size of, let's say it's here looks like it's 0.4, an effect size of 0.4 across these 100 studies. And when they tried to replicate them, the effect size essentially was cut in half. So they actually couldn't really replicate these results. And so I think that's a bit of a problem. Maybe that's an understatement, but I think in medicine, and particularly around systematic reviews, we've actually not explored this very much. And my worry is that if we go to implement things, we should try to make sure there's a certain amount of rigor before we implement them, because if this is a result that you get in medicine, I certainly wouldn't want to be getting interventions that are perhaps only half as effective as they're supposedly, and perhaps they have a much higher or much different harms profile. So I think we don't really see this in medicine, and we don't particularly see much in a way of reproducibility in systematic reviews. Some colleagues sort of looked across 5 different disciplines to see whether we're getting similar sort of results, and I've just sort of highlighted 2 points here, and we'll speak to one of them, that approximately 50% of these results could be reproduced. So I think that that's a problem, and I think we need to address it. So that's 2023. We have issues of reproducibility. I think this is a very important study that is in 2019. Ben Goldacre and colleagues did a very simple little study. Over a 6-week period, they looked at, shall we say, well-known journals, i.e. journals with a high impact factor, and looked to see whether the quality reporting of these studies was good, and whether the primary outcomes matched the protocols. So I think what you see is some very innovative behavior on the part of researchers. Firstly, there was more than 300 new outcomes. That's so wonderful of researchers to be able to come up with new outcomes that didn't exist. And only about half of those actually have protocols. So that's a problem. It's a problem because in a country, let's say like Canada, most of this research is publicly funded, and I would imagine in Australia it's fairly similar. So again, this is 2019, and if we move along to 2023, this is a behavioral scientist, Francesco Gino, who was a professor at Harvard Business School and now has been, in a sense, dismissed by Harvard. It looks like she has perhaps manipulated her experiments for most of her career. So again, some quite innovative behavior on the part of another professional entity. And I could go on really speaking for an hour about this, but I hope you get the point that researchers are very innovative in terms of how they report their research. And that's a huge problem. I wanted to spend a few minutes in sort of thinking about perhaps taxonomy of research reporting. And I think the first point I would want to make is research reports should be truthful. and they shouldn't intentionally mislead. And I think I've given you several of examples of where this is going on over time. And the International Committee of Medical Journal Editors makes a point about you've got to be truthful when you report your research instead of being innovative. Research should be useful to readers, including patients in particular, because they're often the end users of biomedical research. And policymakers are as well, but I'm just making the point that I think for patients in particular, research really needs to be useful to readers. And I think I'm bringing up this point again about reproducibility, which I think is quite overlooked in our community. So I will spend a little bit of time talking about taxonomy of poor reporting, because I'm going to be coming to this. So we have missing studies that are never reported, complete studies that are never reported. And I know you know that it doesn't go on, but we'll just go through the exercise a little bit. Then we have selective reporting of patient outcomes. And this might be coming back to Ben Goldacre's study where they found over 300 new outcomes that were not in the protocols. We have selective reporting of analysis done. So guess what? I'm going to be innovative researcher, and I'm just going to tell you the stuff that has magically passed that 5% criteria. We've got incomplete publication as well. We've got interpretation bias, for which we have empirical evidence. In the biomedical literature, the prevalence is between 30 and 40%, which is a bit of a problem. So what do I think we could do about all of this? I think we could think about reporting guidelines as an intervention. And I've got in brackets open science, because I'm not quite sure where to push open science here, but I think it's very much part of sort of reporting research. So there has been some work done on reporting guidelines. For example, in 1983, the BMJ did some work on a checklist, but didn't differentiate between conduct and reporting. And I'm not going to spend more time getting into these individual initiatives. Safe to say that prior to the early 90s, there really wasn't what we would call a reporting guideline. So you might be asking, what is a reporting guideline? And I think a reporting guideline is probably defined best as having a checklist. Some reporting guidelines have a flow diagram. There's some explicit text to guide authors on a minimum set of information to report. And I want to stress the notion of minimum. You don't have to worry about, oh, should I report this or not? Just report it. And I'll speak a little bit later. I'm not too concerned about word length in manuscripts. I think there's an easy way to deal with that. And nor am I particularly worried about open access publications. I think there's a very easy way to deal with that. And I think another part of reporting guidelines is definitely some sort of consensus-based approach, ideally a face-to-face meeting, but there's obviously some innovation during COVID where that wasn't particularly possible. And I think another critical aspect of reporting guidelines is that they're evidence-based whenever possible. It's not me and a group of people sitting down saying, you know what, I think we need this into as a part of a checklist, as part of a reporting guideline. What's the evidence to support this? Now, I'm going to sort of move a little bit into open science because I think there's quite a bit of overlap. And I think the UNESCO definition of open science is probably the broadest and probably the most useful definition of open science. And it's really about making knowledge openly available, accessible, reusable, and sharing of information. I mean, I think that's the essence of what open science is. And I'm going to come back to that as part of the development of reporting guidelines. But to provide some historical context, The standards of reporting of trials was produced in 1994 based on a meeting held in Ottawa, Canada in 1993. And you can sort of see the outlines of this reporting guideline. It's got a checklist, and it's got the semblance of a reporting, not a reporting guideline, but of a flow diagram. So the editor, the associate editor of JAMA at that time, decided that he would ask a group of authors who had a paper, a randomized trial recently accepted, to report their results using SORT. And I think the experiment was a failure, but good on the editor to get people to do it. At the same time as we were meeting in Ottawa independently and unknowingly to either groups, there was, in terms of geography, a much better meeting going on at Asilomar in the west coast of the United States in California. And they were meeting about 6 months after us. And in the Annals of Internal Medicine, they made a call for thinking about reporting of randomized trials. What should be in the report of a randomized trials? Historically, I don't know why these two groups came to be at the time that they came to be. That's still a mystery to me. But this great man from the desert, Drummond Rene, who was the deputy editor of JAMA at that time, he picked up the phone to me and he basically told me that editors are not the smartest people in the world, and that if you want to succeed, you better come up with one checklist, because if editors had to think of two checklists, they both would fail. And so I took his advice, and we held a beautiful meeting in the Hilton Hotel in Chicago Airport, and we came up with CONSORT, which was the amalgamation of the two groups. And again, you can see the semblance of a checklist and a flow diagram. And so this is the first introduction that I had to Doug Altman, because Drummond asked Doug whether he would peer review CONSORT. Now, maybe I'm not supposed to be telling you that. Maybe that's supposed to be a hidden message, but I don't believe in hidden messages. We should be quite open and straightforward. So that's this sort of historical point of CONSORT, which I think we could say is probably the first modern reporting guidelines. So reporting guidelines are really to report the methods and results of completed research. We also have reporting guidelines for protocols, and they may help peer reviewers if peer reviewers actually use reporting guidelines. So this machine is running faster than me. So here is some of the evidence that we would think about using for an item in CONSORT. Here is a piece of evidence showing that it's the first empirical evidence showing that inadequate allocation concealment compared to adequate allocation concealment tends to increase the bias, tends to increase the point estimates of a intervention. So that's not something one would want in research. We've also developed ways to develop a reporting guideline, and this work is currently being updated. I think in my naivete, as a group, we didn't think about patients, unfortunately, in 2010, and that may sort of reflect why patient involvement in reporting guidelines has been disappointingly low. This is based on an audit of reporting guidelines by Michael Schlessel. The good news is that in CONSORT 2023, we will have an item on PPI, so I think that's going to improve CONSORT. There are also attributes of good reporting guidelines. Again, they should be evidence-based whenever possible. We obviously need to have stakeholders involved in the very beginning, and that typically includes editors, because they are the ones who can actually implement reporting guidelines. And we obviously need to include patients as well. As I indicated, the consensus meeting approach has required some innovation during COVID. I think one needs to think about post-meeting iteration. We need to think about piloting, and we need to think about the checklist as a living document that's updated irregularly. And hopefully with the publication of CONSORT 2023, you'll see that we were quite innovative in developing a living database of evidence that we could go and look at to see whether there was evidence in a particular area that we were thinking about in terms of adapting or updating the checklist. So why checklists? I think they're definitely a way of for authors to remember to report information. Authors, like everybody else, we can forget. They obviously can facilitate critical appraisal, and it certainly puts everybody on the same playing field. I think there's no particular interest in authors not knowing what editors want. I mean, we don't need to play that game. If anybody is interested in checklists, Atul Gayawandi is a wonderful writer, and he's written a book on checklists that have very little to do with medicine, but mostly to do with if you're an architect and you're building something, how do you keep the quality control? And we should think about that perhaps for biomedicine as well. So here is an example of a checklist. This is the ARRIVE guidelines for preclinical animal research. There is a set of 21 items that should be included. Here is CONSORT PRISMA, a 27 item checklist. For item 16A, we ask authors to describe the results of the search and selection process and the number of records. And here is an example of a descriptive way that people have done that. We can see pretty much how the articles have gone through the process of in this case, a systematic review. And we've also developed some more sophisticated flow diagrams that people can use to display the flow of information. And so why do we ask for that? I don't know in Australia whether they had the X-Files, where they had some sort of strange behavior going on. And I think it's really the same information. I'm typically used to reading a systematic review where they included 1,214 studies were screened and 6 were included. And I want to know, well, what happened between the 1,214 and the 6? Is there a lot of bias going on there? And just as a basic rule of transparency and openness, why isn't that information reported to me? So we can find a lot of information about reporting guidelines in the EQUATOR Network. The EQUATOR Network has a library, and you can search the library. It's an open source database. You don't need to register to use it. It doesn't cost you any money. And at the moment, there's about 500 plus reporting guidelines there. The EQUATOR Network also includes a sort of a lot of other information, such as toolkits to help authors. Can you believe it? We've got something here to help editors. I can't believe that, but editors know it all. So I'm a previous editor, so I can really go after these people. And you know, in particular, we can sort of help people. How do you report the information, the study that you've done? And so hopefully these tools are helpful. And if we think about reporting information, coming back to open science again, so we can see that in open science that there's open data, open access, open. It's all about open peer review. This should be a standard policy in every single journal. It's not. In CONSORT 2023, we will now have an open science section where we will be asking authors to tell us information about their trial registration. We'll ask them to tell us information about their protocol and their SAP. Data sharing, we want to know about data sharing, because I don't know the situation in Australia, but certainly in Canada, the United States, and other parts of the world, data sharing is now mandated by our funders. And so we think that it's really, really important to have that in reporting guidelines, and it's sort of very much part of open science. And we may want to also think about adding preprinting, which I haven't heard mentioned too much, but I think it's a way of dealing with lots of information. So why are we focused on issues like trial registration and data sharing? This is from some colleagues in Berlin who looked at randomized trials reported in all 36 medical schools in Germany. And this is quite a startling figure here, is that there's almost a 60% publication bias. So when you're doing knowledge synthesis and you think you've got the information, think again. And what will be published next week in Canada, all the interviews are done, is this. We looked at almost 500 randomized trials that were on clinicaltrials.gov that were Canadian in source. And what you see is 40% of people fail to appropriately register their studies. You see that 60% of them fail to report the results on clinicaltrials.gov. And sadly, about half of them fail to publish their research. And if you take those three together, 20% of 7,000 trials that are funded by me and any other Canadian here who's paying taxes, it's very, very inadequate. So I think when you're doing knowledge synthesis, you have to be really, really worried about issues of, do you have the complete data set? And I can assure you the funders are not going to be happy to see this next week, because we cut and pasted. They did an audit and said they're doing fantastic. So what's fantastic is probably quite different than what I think is fantastic. The notion of openness, I think, is also really important for reporting guidelines. These are two colleagues, friends, mentors, who unfortunately are not with us any longer. But Alessandro Liberati is a very interesting case. Alessandro Liberati was sick, ill, dying. And in 2004, he wrote an incredibly personal opinion piece in the BMJ asking, why can't I get hold of the information? Why can't I get the information? I need to make a decision. Why isn't it available? And I think we need to think about that when we report research. And I think we need to report research where it is accessible, always accessible. And my solution to that is preprints. I don't know whether preprints are common in Australia, but what a preprint is it allows you to submit a manuscript of any length, of any size, to a server, and most journals allow that. You can go to Sherpa Romeo, and they will tell you the individual journals. If you're wanting to put it into BMJ or some other journal, it'll tell you what the policy is of that journal. Suffices to say that about 99% of journals allow preprinting. There's the odd weird journal like the New England Journal of Medicine who live in a different planet and they don't allow that. But the vast majority of journals allow for preprinting. What is the advantage of preprinting? First of all, it's equitable. It doesn't cost you anything to do. It means anybody can read it. They don't have to be at a place where the institution has paid for access to a journal. So preprinting allows you that. You don't have to be confined to 2,000 words or anything. And so I would recommend preprinting. Our federal funders allow preprinting. The other advantage of preprinting is that you get a DOI, and when you get a DOI, you can put that on your CV. You're locked into it, so to speak. So I think that that's very important for pushing information out, and you don't have to worry about peer review or anything. And I think some of you are probably wondering, well, preprint servers are not peer reviewed. Maybe the stuff that comes out in journals is going to be completely different. So we're going to come back to that. I think another aspect of good reporting that I mentioned, for example, CONSORT will have, is data sharing. Data sharing is associated with added value. You get much better citations when you share your data. And I think as researchers, we want that. We want more people to know what we've done, particularly if we've done a study where the intervention looks good and we want it used, or the intervention doesn't look very good and we don't want it used. Data sharing is associated with much greater citations, so that's important. I think also we need to value patient-public involvement. So there's examples here of where we've actually done reporting guidelines specifically for example, patient-reported outcomes, etc. And I think the evidence also is that patients are very hungry for their data to be shared. And I don't know whether there's been any work done in Australia about that, but if not, I would encourage you to do it. I think we need to listen to patients. They want their data shared. I'm just going to leave some open science resources here, if that's helpful to you. Again, I think it's very related to reporting guidelines. So now the question really is do reporting guidelines work? And I'm going to share some information we have about that. So it's mostly around CONSORT. We do see that CONSORT has been endorsed increasingly over time. It's certainly not sufficient endorsement, and there are different sort of gradations of endorsement, so we need to think about that. We do have direct evidence that, in this case, CONSORT improves the quality of reporting. This is Eric Cobo, who's done a randomized trial, randomizing peer reviewers to receive the CONSORT statement as part of their peer review process or not. And the primary outcome was the quality of reporting of the published product better. And those who were randomized to receive CONSORT, the quality of publication was higher, was better. So we do have some evidence about that. We have indirect evidence. looking at whether journal endorsement of CONSORT is associated with improved completeness of reporting. This is again looking at allocation concealment. I'm focusing on randomization because in a randomized trial there's really nothing more important than randomization. So here you can see quite clear evidence that of journals that endorse CONSORT, the reporting of allocation concealment is much better than in journals that do not endorse CONSORT. So again, this is another type of evidence. And I used ChatGPT to just generate some articles that also indicate that use of reporting guidelines in different fields works. I wanted to spend a little bit of time looking at other sort of developments of using reporting guidelines. There have been quite a number of randomized trials. Some of them show effect, some of them don't. And so what's really interesting is, I don't know if I can go back. No, I need to go forward now. So this is a web consort, which is an interesting trial done across over 40 journals. And I know I'm bashing on journals, but who else can you bash on? So this was an interesting trial because what we asked the editor to do, or the editorial office, we asked them to do something very complicated. If you see a report of a randomized trial, can you allocate it to one of two groups? And we had to get rid of a third of the data because the editor and/or the editorial office did not recognize what a report of a randomized trial was. So that was very frustrating, and it may suggest something about endorsement and implementation of reporting guidelines in journals. But there has been quite a lot of work done on for early career researchers. Do reporting guidelines help them improve the openness, the transparency and completeness of reporting? There's also been work done on, in a sense, what interventions could be used to increase adherence of reporting guidelines. And I hope that work will continue and we'll get some further work on that area. I think a common strategy I hear from authors, as in this editorial, is that reporting guidelines are too complicated, they're not simple enough. We need to spend 9 months doing our trial, but we need to spend 2 days writing it up. And we need to get it published. And so I think my argument is that randomized trials, like all other research, are complicated. And knowledge synthesis is complicated. And so if it's taken you 9 months to do your knowledge synthesis, you could take more than 2 days to write it up. And I think that this is something we really need to push very hard. That there's no reason that you have to write up your report in 2 days or in 5 days. You could actually take time and try to make it proper. Because I think if you remember what I said very early on, is we're not very good at reporting research, and we need to get a whole lot better, and maybe taking some time to do it. I think I don't know how, am I okay for time, or I am good? So I'll just talk a little bit about implementation strategies at some journals. So here's a headache. So what they did, this is a very small journal, but they actually have a special section on reporting guidelines, and you could sort of click on the little highlighted button there, and it would take you to a couple of articles written by the editors as to why they're introducing reporting guidelines and how they want authors to implement reporting guidelines within their journal. This is a very clever editor. I said clever editor. This was a chap who was very interested in implementing reporting guidelines, and he had called me up and said, well, how could I do this? And what he felt is that if he implemented reporting guidelines, that authors would simply go to another journal because they didn't want to waste their time with using the reporting guidelines. So what he did is he actually got 34 editors, all of the editors of journals in this field of physical medicine and rehabilitation, and they all introduced reporting guidelines at the same time. And so that was a really clever way, I think, to implement it. I have asked this editor on more than one occasion, could he share any data with me as to whether this was an effective implementation strategy. I'm still waiting on a response. What I think we're going to try to do for CONSORT 2023 and perhaps introduce for other reporting guidelines is sort of a toolkit to think about that. I think we need to really help authors and, dare I say, help editors and peer reviewers as well. I wanted to sort of end, again, another great collaboration with an Australian group in Melbourne. This is Prismatic, where we're actually trying to sort of harmonize Prisma extensions, and it's I think it's a good idea. We're going to try to do a randomized trial, not unlike some of the trials that we've done for CONSORT in particular. And I think that if we can think about Prismatic in terms of meta-research, I think it's probably really important to think about are there a core set of items that we could include across all Prisma extensions, because then that leads to important meta-research. If we don't have a core set, then we can't do meta-research. I think that's it, and I hope that was somewhat helpful to you.
David, please join me.
Thank you.
This is a drop of water.
Oh, perfect. Thank you. This is a gin and tonic, quite early in the morning, but enjoyable.
I'll have one also, thanks. David, thank you for that fascinating presentation. Time for some questions, and please send some more through. Some have come through. I'm sure many of you have questions. I'd like to start with a bit of an icebreaker, an easy icebreaker for you. Back your first meeting with the SORT group, and when you and colleagues identified, I guess, the need and also the opportunity that this type of work that there was a requirement for it, and the opportunity it might represent in terms of helping improve things. Thinking of guidelines as an intervention and reflecting on it all, have they been as effective as you'd hoped way back then? Well, 20 years later?
No.
No.
No, but I think the problem is that it requires implementation at a different level. So it requires editors, it requires funders to say something quite strong about using them. So there are some exceptions. There are, I think JAM is one exception. They require a completed checklist. I'm sure there are some others, but it requires a much more vigorous implementation at a journal. It basically requires it requires a reporting guideline to be integrated within a journal manuscript like Scholar 1. It has to be integrated properly, and that hasn't happened yet. Also, there's pretty good evidence that editors don't recommend peer reviewers use reporting guidelines, so that's a bit of a disappointment.
Okay. Thank you. Thank you for your thoughts there. It was interesting to see some of those numbers and how far still even publicly funded research has to come in terms of appropriate reporting. That was quite enlightening. So we have some questions coming in, and we'll get onto that topic of peer review in a moment because quite a few of them are related to that. You spoke about preprints and the opportunities that they offer. So the question that's come from the audience is, how do we mitigate the benefits or preprinting with its challenges? For example, a lack of checks which could lead to misinformation being implemented into practice.
I think it's a great question, and I think we don't have the complete answer. But what we do know is the evidence is pretty clear, particularly from COVID, that if you look at primary outcomes that are in a preprint and you follow them up to publication, it's almost identical. We need more research. I think we need to see what the next 2 or 3 years will bring us. But if we look at it if we think about it as a cross-sectional cut point, the evidence that we have today is that there's nothing going on preprints that differs than published reports. And I think that's very, in a sense, it's very positive because I think there are very, very, very few people who have been trained to do peer review. And so I wouldn't expect them to be able to pick up too much.
Yeah. Listening to you speak, that obviously when you say there's very little going on in preprints that isn't going on in the published journal, well, what we all rely on is that it actually is independent and high-quality peer review. On the latter, that people will identify the preprint, actually maybe it's not there, so is it trustworthy, should we be implementing it? But it seems that unfortunately that may not be the case.
Yeah, I mean, I think we need to wait and see, but as of November the 17th, the evidence is pretty clear that what you publish in a preprint, what you publish in in a journal, does not differ.
Yep. Okay. We'll get on to peer review in a moment, but we have quite a popular question here. How do you think we should report articles published in predatory journals within an evidence synthesis? Are there some nuances there for us to consider?
Okay, so I think I'm trying to be polite here. I think most groups who do knowledge synthesis, I think, would rarely check whether they're included studies or whether any of them are retracted. I think they would almost never check whether any of them are from predatory journals. And I think they probably don't check on a whole bunch of other things. I think they take these included studies and think they're gifts and that they're perfect. But I think our group standardly check for are any of them in retractions, or any of them in predatory journals, or in journals that are have troubling behavior. There's one large publisher who I think last year had 25,000 special issues. That's unusual behavior. And I think, you know, I'm constantly getting emails asking me, what should I do about this publisher? And I said, look, here is the evidence. And I would be very cautious. You could include it and do some sort of sensitivity analysis to see whether the point estimates, if you're doing a traditional review, whether they're consistent or whether there are inconsistencies when those studies are taken out.
Yeah. Okay.
Yep.
So some exploration of the results.
Yes.
Wow, 25,000 special issues.
Yes.
I know in our journal, I'm happy if I can concoct a couple a year. So that's great.
Yeah.
Okay, so thinking about all of that and peer review, and we've had some mention about the publishing system and potentially being broken. Well, peer review is such an important part of that whole system that we all rely on. And alluding to what David just mentioned about a study being something special, peer review adds to how special it is. So, by show of hands in this room, how many people have actually had formal training in peer review? One over here. Two?
Okay.
Two. And there's over 200 people in this room, yeah. I'd suggest. Any comments?
Well, I think the analogy I like to use, and it's perhaps funny or perhaps insensitive, but I mean, basically we're saying to somebody, would you have a look at this paper with no training? Well, what if I said to you, would you have a colonoscopy with somebody who's had no training? And I guarantee you that 99.5% of you would say, no way, thank you. And yet we're willing to have peer review. Somebody may have been funded to do a study, and we're quite prepared to say, we're going to let somebody look at this who's not trained, we're going to trust them. There's something wrong with that model. There's something very, very wrong with that model. And I'm going to spend the next 12 months of my career, I think, trying to see if I can change it a little bit. I have never been able to get a publisher interested in funding. We've developed core competencies for editors, which we've published. We want to develop core competencies for peer reviewers, which is a much, much larger audience. All the publishers say to me, what a good idea. When you've done it, send it to us, we'll use it. But they don't want to fund it.
So, in light of that,
yeah,
and thinking about the publishing system and your observations here and questions around peer review, do they have a role in health research? And what is, I mean, often you hear them described as gatekeepers of the quality of research. Are we asking too much of our peer reviewers? Or is there something that you think we can do in between to actually realise that expectation?
Yeah, I think it's probably, my sense, it's probably a failure of universities and institutions of higher education. Along with the question that Ed asked about peer review, how many of you have been formally trained in research integrity? Oh, so there's an increasing number of people. That's wonderful. It seems that I teach a graduate level course on publication science, and I think I've done it for a number of years, and I think the students typically say to me, why isn't this mandatory? And why isn't it taught across the whole university? You know, we're teaching about peer review, research integrity, etc. So I think universities have failed. And I work in a very large research institute, and what are they interested in? They're not interested in what I have to say. They're interested in, this researcher has a new molecule. And that new molecule is going to be really important. And when I stand up and ask that researcher, what is the success rate, the translational success rate of taking the molecule to the bedside? Oh, it's less than 1%. So, you know, it's what are universities interested in, what are institutions, and they're interested in molecules, I think.
Yeah. Okay, thank you. Well, the gauntlet's been thrown down for all of us. Zoe, you had a question?
Hi, David. Thank you for that. I loved your presentation, and I think it's been really thought-provoking. And I did put a version of this question on the app. And we asked the question of who's had training in peer review, and there were, I think, 2. But I think, you know, in addition to that, something that I've been thinking about for several years is almost, I would guess, almost every person in this room had some training in critical appraisal. And And what I can't work out, haven't been able to work out, is why we don't critically appraise papers pre-publication with the same level of rigour that we do post-publication. And if peer reviewers were using critical appraisal checklists in the same way that we do when we conduct a systematic review, surely that would overcome some of the issues that you're speaking to around reporting.
It's a really good question. And I'm not sure why that doesn't happen. So, you know, if you and I go onto Google or onto Amazon and we're looking at a product, we'll see that that product has been appraised, whether we call it critical appraisal, and maybe we'll think, oh, 3,000 people think this product's good, maybe I feel safe to buy it. And if you look at models like F1000, where you can actually do that, and other journals, they don't seem to do it. And I wonder whether they don't do it because they're not getting anything for doing it. They're not, it's not part of their career advancement or something. And I wonder whether we should be thinking a little bit outside the box about those sorts of issues. And I think critical appraisal may be part of peer review, but it's certainly not all of peer review. So, you know, when we think about patient engagement, like I'm unfortunately leading a breast cancer screening, I have to make sure that the patients we have engaged are objective, are not paid by an activist group, etc. And I think in peer review we need to actually be able to look at that. And that's why I think open peer review is very, very important. And we can then size up the objectivity of not just critical appraisal, but maybe a peer reviewer has some beef with a paper for a whole variety of reasons.
Thank you. We have plenty of time. I'll just pick up on that one quickly. This idea of open peer review and publication of peer review reports. One thing that's always frustrated me is that that gets published when the manuscript is accepted and published. But the peer review of the manuscripts that get rejected never makes it to the limelight. And oftentimes, the authors might make some changes, they might not, and then they'll send it off to the next journal, and it'll run the gauntlet of the peer reviewers that are invited by the editors. How do we mitigate some of those issues in this whole system?
We need to make everything open. And I think editors and publishers have some responsibility to help that happen, because as someone who is very interested in researching peer review, if I don't have access to that information, then I'm not able to really do comprehensive research. Yeah. So I think we need to make it open.
Yeah. Okay, thank you. Was there a question back there? Maureen, please.
Yeah. Thanks, David. Amazing presentation. So I'm picking up on the slide about the results that will be presented next week from our funders, our national funders. And I'm wondering what your thoughts are on the funders' responsibility in assessing the extent to which researchers they funded in the past are actually doing things like registering those trials and those sorts of things. So can they be more, I don't know, accountable might not be the right word, but what can funders do to hold researchers accountable to following those things in order to get that next grant? So if you're not doing these things, then you're not eligible when you submit your next grant. I mean, they do that already in certain things. If you don't submit Canadian Institutes of Health Research, if you don't submit that final report, you're not allowed to get additional funds, apparently, until you do submit that. So maybe they could be more involved in this.
I agree with you, Maureen. I've had personally quite a lot of trouble engaging funders, at least in Canada. They always feel if they're engaged in something, then they think, oh, it won't be equal for other researchers and they'll think you're somehow special. I think what funders should do is have a digital dashboard to audit. So digital dashboards, for those of you who aren't familiar, they're ways of picking up metadata about information from research, and they're becoming very, very sophisticated. And so if, I'll just give you one example. So the Charité hospital in Berlin is probably the second or first largest hospital in Europe, and the Berlin Institute of Health is their research wing. So they have a dashboard, and they know from all of their faculty and staff members how many of the publications are open access, how many people share data, etc., etc. And in our own group, we are piloting digital dashboards for other institutions so that they can track this information. And I really think that the technology is at such a level that funders can easily do this and act upon it. They could really see what's going on, and they could do something.
Thank you very much for your sharing of your wisdom and your presentation. I greatly enjoyed it. I have a question regarding open peer review. I did have a request, I think it was from BMJ, to review an RCT, and my name would be open, would be available to the submitters, to the authors, along with my comments, and that was a disincentive to do it. So, and I didn't support the study, not because there are any methodological concerns, but because of some of the ethical concerns in terms of the context of a lower middle income country. And so I'm wondering if you could comment on how does open peer review potentially affect incentivization for qualified researchers or peer reviewers to actually participate in review?
Thank you. I think you raise a very good point. I mean, you know, I'm an old white man. My career is well past its midpoint. It doesn't matter to me, but if you're an early career researcher, if you're a person who has a different perspective than the authors, then I think it's difficult. I think what needs to happen is that institutions need to speak up and support their faculty and staff to be open, and that they will be protected, and that the more openness there is, the less likelihood there will be for retaliation, because everything is open. But I think institutions are, you know, they're supposed to be the center for the next generation and subsequent generations, and I don't think they do enough to support faculty and staff. I think there are legitimate issues in openness, and I think there are definitely people who feel threatened or uneasy, but if the institution is standing with that person, I think a lot more could be done.
Thank you. We'll have a couple more questions, and then I think we're going to let David go, because we've been working him quite hard up here. Peter, please.
Hi, thanks for What? Yeah, Peter Bragg from the Breakfast Buffet. Just a quick question. Have you considered building reporting guidelines into the registration stage of research? So, you know, some of the information when you're registering a trial, you know, you could be filling out, you know, CONSORT type items that you then track into the publication. And similarly with Open Science Framework and Prospero, I'm just wondering if that might front load some of the work that academics get a little bit anxious about doing at the end.
Good question, Peter. So, for protocols of randomized trials, there's SPIRIT, and SPIRIT has a a software called, I think it's called Sapphire. I could be wrong. But once you've completed it, it automatically registers you on clinicaltrials.gov. Now, there may be, depending on the geographic location, there may be impetus to also register on a local registry. So I think it's started. Interestingly enough, we had several discussions with medRxiv, which is the preprint server mostly for biomedicine, and they were not interested in having reporting guidelines there to help with them thinking about the trustworthiness of what would be on a preprint server. So maybe we need to revisit that.
Thank you. Well, one final question here, please.
So, David, just, I suppose, a couple of comments, really. So, just in relation to that particular question, I actually think if you use reporting guidelines in design, you actually, if you like, tick off some of those things as you go along where they're relevant. So I think that's a useful thing to think about as a primary researcher. And I think the other thing is in terms of the open peer review, if we're actually able to train peer reviewers, then some of the reticence to become a peer reviewer may actually disappear. I'm an editor of a very small journal, but we actually are about to start training our peer reviewers, mainly because we have so much difficulty in getting peer reviewers, and I think actually if we're able to train them, they may be more willing to do that. So just a couple of comments.
Thank you, Heather. Thank you, everyone. I think on that final comment, I'd like you all to please join me in thanking David for his presentation this morning. And David, a small sign of our appreciation.
Thank you so much. Thank you.